But another study in Alzheimer's patients sometimes found it to be as high as 70 or 80%. For instance, research by Dr. Suzanne Dilamonte
Mhm.
at Brown University has drawn attention to the concept of type 3 diabetes.
Yeah, again, I don't love the term, but I appreciate the use of it, which is it does suggest a metabolic origin. But even you look at those ranges, Stephen, you'd say, well, one was 40, one was 80. Boy, what a difference. I suspect a lot of that is just how did they measure insulin resistance?
Right.
If they were looking at the glucose, like so many do, you're just going to miss a lot of people.
Yeah, it's quite hard to. I think there's different criteria, right, for how one defines someone as insulin resistant.
Well, yeah, and that's right. That's because there's not enough training, which is at the beginning of the conversation, you asked my mission. One of my missions is to help people learn what to look for.
What do they need to be looking for?
Yeah, they need to be looking at insulin. So,
Is that easy to measure?
well, it is technically easy to measure. It's just that we don't have enough systems in place to allow it, to enable it. Like again, if someone listening in the UK were to go to their GP and say, "Can you measure my insulin?" In many instances, they literally can't get it done. The system just isn't in place to take it to the lab and measure it. Now, some do. I know some physicians in the UK who do so, and they have developed their own way of getting it done. And they're incredible advocates of this whole idea. But it is harder in the UK and in Canada, where the system is such that they have said, out of ignorance, but perhaps well placed or well intentioned, they will say, well, insulin isn't a marker that matters. It is. And if you're measuring insulin resistance, just to put things back to where we had talked about it earlier, many people with insulin resistance have normal blood glucose levels. It's the insulin that's high. And so I would say if a person can get their insulin measured, get it measured. In US units, if it is anything above about 10 microunits per mil, that's a warning. In UK units, if it's anything above about 40 picomoles, that's a warning. Insulin is high. You could have insulin resistance.
And you could be skinny
Oh, yes.
and have insulin resistance.
Yes, that's especially depending on the ethnicity. Like if someone listening to this is East Asian and they say, well, I'm quite thin, I don't have insulin resistance. You very well could. It depends. Even in young women, a group out of Northern Canada, which is, of course, pretty far north, they found that even in young, healthy weight women with PCOS, if they compared them to their identically matched other women without PCOS, they were more insulin resistant in the other group.